Alrighty, so we're going to be reviewing changing out an ostomy appliance and ostomy care. So the first thing we're going to do is we're going to take our wash rags and our towel. We're going to lay the towel out on our patient and use a warm wet rag to kind of help remove the appliance. So we're going to change the appliance every 3 days, or if it's leaking or otherwise ordered, we're just going to gently peel back. All right, after we've removed the old appliance, we're going to take a look at our ostomy. We're going to take a look, make sure that it's pink, it's not bright red or dusky. We're going to look at the center of the ostomy or the os and make sure that it is centered. And then we are going to take that warm, wet, soapy rag and just gently clean around it, okay? And after we're done with that, we're going to pat it dry. From our supplies list, we're going to get our measuring guide. This is a smaller one. Okay. So about an inch circumference. So what we're going to do now that we've got our measurements, we're going to take another ostomy wafer from our supplies and we're going to cut based on our measurement, and we're going to typically go about 1/8 of an inch larger. What I like to do is I like to cut it into 4s and then follow the guide to cut it out. And we always want our ostomy wafer to be just a little bit larger than the ostomy so that it's not compressing on it and causing damage to the skin integrity. Okay. After we've got that, we're going to take our skin prep or our barrier spray. And we are just going to wipe around the ostomy where we're going to be sticking the appliance on. Let that dry. Then we're actually going to apply the device. And you can see the wafer is cut out just a little bit larger. Okay. All right, after that is placed on the patient, we're going to take the second piece of our 2-piece ostomy system and simply clip it on. Come on now. My table's moving on me. There we go. There you have it. And you'll make sure that everything is clipped. Typically, there'll be a clip that comes with the 2-piece system. You're going to document who changed it, which kind of device you changed it with, the assessment of the ostomy site, any effluent or whatever's coming out, what you find in the clear bag afterwards, making sure that that os is centered, as well as how well the patient tolerated it and what you did to provide care to the site afterwards.